you can do that for your own. But if you're going to give that to other patients, you should have your tests done.
But you
tests, I mean, how much THC and CBD is in there.
And I totally agree, but you can test it after you grow it to make sure. Now, I have a couple of questions from myself.
Okay.
One of which is, Dennis was talking about how the carboxyl molecule needs to be taken out of the cannabis oil. Is there a method of testing if it has been taken out of the cannabis oil?
Yes, I mean, it's very easy to, once you understand why you have to decarboxylate the molecule, you will see that it's very easy to check if you have decarboxylated. What the plant has is something that is called THCA. Yep. And the A means acid. And acid, in chemical terms, we call it carboxy group. So it's a fancy way to call an acid. We call it carboxy group, but it's the same thing. So what the plant has is a lot of THCA. It's the acid form of THC.
Right.
What kills cancer cells is THC without the A, without the carboxy group. Yep. How do you get rid of the carboxy group? Heating up the oil.
Yep.
So probably when Dennis was saying that the first oil he was taking was not producing any effect because it was not decarboxylated, he was probably using a raw cannabis extract, something that was not heated up. So he didn't have enough THC.
Yeah.
So he was having a lot of THCA, which have some beneficial effects, but it's not as potent as THC in killing cancer cells. How can you produce more THC in your oils? Heating them up. And that's what most people do. If you see in the internet protocols to obtain cannabis oils, they all include a heating up step. Yep. And it's for this decarboxylation. So you convert THCA in THC. So going back to your question, how do you know if you have decarboxylated your THCA? You just measure the amount of THC you have in your oils.
Okay. So is there like a test kit that you can obtain for?
Unfortunately, there's not. I think there's one in the market, but I don't think it's precise enough to. I mean, I don't think it's reliable enough. We need very sophisticated machines to measure the amount of THC and CBD. But there are labs all over the world that can do that. So it's not that easy. It's not that difficult. Sorry, it's not difficult.
Second question, quick question. Does the oil have a shelf life? Does it lose THC and CBD after a certain period of time?
Well, you have to keep the oils in the dark because cannabinoids are photosensitive or light sensitive. Yeah. I don't know which one you use, and you better keep them in a freezer. But other than that, they are pretty stable compounds.
Okay, great. Okay, it seems like the recorder is still ticking along.
Perfect.
And I'll just look for this next question, if you bear with me. Please explain the entourage effect of how phytocannabinoids and other cannabis enzymes work cooperatively to efficiently and effectively treat cancer. You've probably got into that a little bit from what you were just saying, haven't you?
Yeah, remember the orchestra thing I told you? I mean, the key is that all these compounds that are present in the plant, they all have different mechanism of action. So they target different things. Mm-hmm. So if you combine them, instead of using one isolated cannabinoid, if you combine not only cannabinoids but also the other compounds that are present in the plant, you will have a higher and a more potent and a wider effect. Okay. That's the key.
Okay, all right. Well, that's that question. Now, going down the list, we have another question from a David from California. whose daughter-in-law is expecting her first baby, and also learned that she had stage 2 breast cancer. Does Dr. Sanchez know of any cases such as this that may have used cannabis, and what dosage is needed to fight breast cancer? Thanks for your time. Tricky question.
Well, it's a very tricky question. Dosing, any question regarding dosing is very complicated for me to answer.
Yes.
Well, first of all, I don't work with human patients. I'm not a physician. I'm just a biochemist. So I just work with mice, and that's the only animal that I work with.
Not quite the same.
So,
not quite the
sorry?
same as not quite the same as pregnant
Nothing
women, is
to
it?
do.
No.
Nothing to do. No. So, I mean, there are very good places in California where they can assist better than me in dosing. But pregnant women is something very delicate, because we know that cannabinoids go through the fetus, through the bloodstream. Because when women are pregnant, they share their bloodstream with the fetus. And we know that cannabinoids travel through the blood, through the fetus. So on one hand, using cannabis when you're pregnant is not such a good idea, because you know that the compounds will go to your developing fetus. And we know that cannabinoids somehow affect the brain development. On the other hand, we don't know how important the effects of cannabinoids on brain development are in human patients. We know that they do things on our preclinical models of maternal consumption of cannabis. They produce things, but it's not something really major. So there are some deficits, but it's not something, I mean, you don't have retarded kids, or they don't have retarded offspring. But they have some things. But like in everything in life, you have to put in a balance the potential risks and the benefits. And if she's fighting against cancer and cannabinoids can help, I don't know, I would use, for example, something rich in CBD, because CBD doesn't have these effects on development. And it works very well, or at least in our preclinical models, it works very well on breast cancer. So in this particular case, I would first inform the patient that it has been observed that the cannabinoids can go through the bloodstream to the fetus. And then I would suggest to use, if she wants to use cannabinoids, I would suggest to use something that is very rich in CBD and very low in THC. That would be my suggestion.
Very, very delicately answered and very informative at the same time, Cristina. Great answer for that. And I sort of agree with you, not that I know much about it, but it seems like the CBD not having such psychoactive effects, psychotropic.
Yeah. I would.
Here's another question from Crystal, and this is the last question, and I'm just going to stop this phone. Oh, excuse me. Not very professional, but that's the way it is.
It's okay.
So this is it true that THC can make certain estrogen-positive breast cancer tumours grow in certain patients? And is high CBD strains better for breast cancer? Now this is right up your alley, isn't it?
Well,
almost. Apart from the fact, this is almost right up your alley, they say. It's right in your field of research.
That's what I work on breast cancer, and one of the types of breast cancers is one that is positive for estrogen receptors. So we have been receiving lots of mails lately regarding this particular issue, and I work on a specific type of cancer which does not express these estrogen receptors, and for these tumors, CBD works really, really well. For those tumors that express estrogen receptors, There have been some reports, very few reports in the scientific literature, where they see an increase in tumor growth. But I have to say that these models were very particular. The immune system of the animals that were used in these experiments was not normal. We have done experiments trying to answer this question, and we have never seen pro-tumoral responses induced by cannabinoids, even in estrogen receptor tumors. But this is something we have to check more carefully, because we know that in the plant there are some phytoestrogens, so estrogens that are activating the estrogen receptors. So what we are doing is trying to work a little bit more on the preclinical models of estrogen receptor positive breast cancer to see if we can find any pro-tumoral action, but we haven't so far. And we also want to get data from patients that are taking cannabis oil to see if those that are estrogen receptor positive have a different response than HER2 positive or triple negative, which are the other types of breast cancer. So I would say, in summary, we have not seen any pro-tumoral responses in this type of tumors in our preclinical models of cancer, but we are aware that there are some phytoestrogens in the plant, and we need a little bit of more information to be absolutely positive that nothing wrong is going to happen.
Okay. A great answer again. And that's all the questions I've had. These are all questions from the patients of Cannabis site in America. So I put a little message in there that I was going to interview you, sorry. And
Okay.
And these were the questionnaires that I got.
If they have more questions, you can give them my email, and I will be happy to help them if I can, of course.
Fantastic, Cristina. And well, I'd love to interview you again. You've been such a pleasure to interview, and so informative. And what was that? What was the place in Chile that we were talking about? What was the name of that?
Well, I was mentioning before a foundation in Chile. It's called Fundación Daya, Daya. And this foundation is led by a fantastic woman, Ana Maria Gasmuri. She used to be an actress, and she gave up acting and decided to dedicate her life to help patients using medicinal cannabis. So cannabis is illegal in Chile, but she has made incredible achievements in the last year. And for example, they have been allowed to make a huge cannabis plantation to produce cannabis oil and to treat 200 cancer patients. And in this clinical study, the university is involved, some hospitals are also involved. It's of course allowed by the government. So we will have soon the first results of a clinical study performed thanks to a person that decided that it was not fair to wait any longer for the patients. So I will send you the link because it's really, really interesting what they are doing and what they are achieving.
That sounds fantastic as well. I'm looking forward to looking into that a little bit more. Well, I think we can end it now, Cristina. I could talk to you for hours, I'm sure. I find it so interesting listening to your explanations on cannabinoid research, and I'd just like to say from everyone that's asked the questions, thank you. Thank you for your time.
You're very welcome. I apologize for my lousy English, but I hope you understood everything I wanted to say.
Very, very easily I understood everything you said, and so no, it was much appreciated, and hopefully I'll get to do it again.
Okay, whenever you want.
Don't say that.
Okay.
All right. Well, thanks very much, Cristina. And,
thank you.
And have a nice day.
You too. Bye-bye.
Bye, Cristina.
Bye.